Okay, now that we've finished the unit on skeletal system and we have done the disease days, I wanted to clarify a few things about diagnostics, careers, and technology like I always do at the end of the unit. First of all, some common bone problems that you can have. Low bone density and osteoporosis, which you've definitely heard of, may cause your bones to be weak and more likely to break. So osteoporosis is more likely to happen in older women, probably age 55 or above. It does happen in men as well, but it's more likely and more common in women over the age of 55, hitting 60, 65 as well. Osteogenesis imperfecta makes your bones brittle. That will be on your exam. Patch disease will make them weak, and other bone diseases will also make them easy to break. There's many different kinds of bone diseases out there. This is just a general format. Bones can also develop cancer and infections, as we know. Please take into consideration if you break a bone, you need to have it checked out by a doctor. Other bone diseases are caused by poor nutrition and some genetic factors as well, which we'll get to more of the genetic issues when I get to muscles on the next unit. And some problems are going to be with the rate of bone growth or rebuilding. So sometimes people will have slower bone growth or rebuilding based on different nutrition, like we talked about with calcium exchange, or genetics. A DEXA scan, this is a way to diagnose bone disease. It's the best way to diagnose a bone mineral loss, whether it's still at the age of osteopenia or has developed into more severe osteoporosis, which again is more likely to happen the older that you get. The best approach for diagnosis is to have a baseline scan, which means it needs to have a starting point to compare later readings. Without a baseline scan, physicians cannot compare, I suppose we cannot compare current results with themselves, but they can compare current results based on a person's age, weight, and build with the other populations. And it will estimate a probable bone loss, but not a definite bone loss. Diagnosis of osteonecrosis. Necrosis means dying of. Diagnosis of osteonecrosis requires first a comprehensive physical exam, and then followed by appropriate MRI scan of the bone. Careers having to do with bones and kind of ways to look at bones more is going to be an ultrasound technician. Basically, they only perform ultrasounds. Chiropractors, again, they will improve skeletal health by bringing proper back alignment and possibly hips and bone alignments, depending on what is wrong. Rheumatologists, bone doctors relieve the symptoms of arthritis. They'll also prescribe their correct prescription for you. Orthopedic surgeons, wide variety of bone conditions. And orthotists support and shape the skeleton, kind of a lot like chiropractors, but that's a different concentration. And then you have the musculoskeletal oncologist, which will study the bone cancer. More careers I didn't mention on the first slide will be exercise physiology, sports medicine, orthopedics, even neurology, some physical medicine and rehab, some psychiatry. I already said rheumatologist. Occupational physical therapy will also. There will be some pathologists that will specialize in reading bone biopsies. Not everyone will be a specialist that will involve bones directly, but certainly will do secondary. Okay, so technology for the bones that are used currently. You have artificial bones, which you'll see a lot in veterans. They will actually, it almost looks like Wolverine. They'll basically put metal inside bones sometimes, or they'll give you a complete prosthesis. Bone density scans like the DEXA scan and other bone scans that they have to make sure that you don't have any kind of osteoporosis or osteonecrosis developing. That's it. Make sure you study for your exam on next class.